Hi, this is Dr. Owyoung at Soft Touch Dentistry. Today we're going to talk about an interesting topic, and the topic is gum disease and diabetes, or diabetes and gum disease. We don't know what comes first, but there are very strong correlations in those two things. So, we all know about diabetes and what diabetes does to the body. It affects, the eyes, the nerves, the kidneys, the heart. And what they're finding is the fifth factor may be gum disease. So, I did a simple little literature review. And if you guys are all interested, go to Google, just Google it up, gum disease and periodontal disease and diabetes, and you'll see all this information come up. And basically what it tells us is that if you do have diabetes, you're likely to have gum disease. And when you look at just the cross-section of patients, I believe ADA, American Dental Association, said that about 60% of Americans over 60 years old have gum disease. It's about 50% in that of Americans at age 30. So it's a real common thing. And we do know that diabetes, type 2 diabetes, is on the rise, for many, many factors. But how does it all link together? Well, we do know that with diabetes and high blood sugars, what we see is an increase in sugar in the bloodstream as well as in the saliva and in what we call the cervicular fluid, or the fluid in between the gum and the root of the teeth. And we do feel that increased sugar actually creates a better environment for the bacteria that cause gum disease. So if these bacteria proliferate and they create the chronic inflammatory disease that gum disease is, it's one of the major loss of teeth that we're seeing now in Americans. So what does it all mean? It means that if you have diabetes, absolutely you need to make sure that you get good, regular, routine dental checkups. Okay, the first thing is prevention, of course. And then if you do, what can we do to help you with periodontal disease? And if you look at the literature, it'll tell you basic stuff, cleanings, better home care, brushing, flossing, and possibly some of the other adjunctive tools that we use. We also can refer to a dentist who is a gum specialist called a periodontist, and they actually will do more advanced treatments in taking care of gum disease. Now, why would you want to do that? Because one, you want to save your teeth, but second to that is we do know that chronic periodontitis, which is a bacterial infection, will actually lead to increased blood sugars. So it makes your diabetes that much harder to control. Okay. We also know that these bacteria that cause periodontal disease, if the gums aren't cleaned up and deemed healthy again, they get into the bloodstream. And do they cause the other systemic issues that play with diabetes? Very possibly. So we do know in heart disease, when you get the buildups in your heart blood vessels, do we find these periodontal bacteria? Absolutely yes. We do see them in the other organs as well. So creating a healthier mouth and a healthier barrier again so that the gums aren't leaky, allowing the bacteria into the body, is absolutely important in your overall health. So please, go see your dentist, make sure that your mouth is healthy, and have a better life. Thank you.